Hey guys, as promised, this video is all about the SI joint. A lot of people have SI joint issues, and there's a couple of habits that I want to talk to you a little bit about that can create more issues in the SI joint. So if you are doing these things, maybe stop and take a look. And the first one, this is probably the most common, is to stand with the hip jetting out. That tends to put more pressure on the SI joint, and it can send pain in the lower back or down into the bum. It's different than sciatica that usually sends the pain all the way down the leg. But if you tend to stand on one leg more than the other with your hip popped out, your SI joint may not be super happy about that. The other thing, I have to show you this really cool chair. See? The other habit that I see the most of is when we sit, especially when we're driving, we tend to sit crooked, or if I was in a couch and I sit like this all of the time, which actually is my habit. It's super comfortable for me. That can also put some pressure on the SI joint. So if you have SI issues, it's recommended to at least switch up your position frequently. Sit up nice and tall, keep your hips level. Same thing when you're standing. If you stand on one leg all the time, be conscious of that and either switch legs or stay on both so that your hips are level to take some of the pressure off. Now, what you guys are all wanting, you don't care about that. So what you're all wanting are the exercises to help strengthen the SI joint. And as we go through them, I'm going to just talk to you a little bit about why they help maybe. So the first one that I really love is a lunge. And the lunge, keeping your left knee or the front knee, whatever one you start with, right over the front ankle. And then instead of allowing your pelvis to roll forward, you're going to tuck your pelvis, bend the back knee, and keep that pelvis up and down. What that does, a lot of us, when we have SI joint issues, we really like to, I'm switching legs, sorry. We really like to just stretch because it feels really good back there. But what happens, the SI joint is a pretty stable joint, and a lot of the cause of pain is when it becomes slightly unstable. Then when we stretch it, it becomes even more unstable, and the pain, it's this cycle, it comes back. So we really want to strengthen it. So come into that high lunge with your pelvis instead of forward, tuck it, and hold here. But then there's a little bit more, like I talked about, your crooked hips. So right here, my right hip is coming out more. You're gonna wanna drop your hips so that they're the same level. So do 5 lunges on each side, holding for 10 to 15 seconds per side. The next exercise that I really like to do to strengthen the glutes, hold the SI joint more in place, is a hip hinge. So come to a wide-legged stance and then hinge at your hips, but keep your back, your spine straight. Come all the way to the floor or as far as you can without bending your spine. So if you come here and your back starts to arch and bend, that's your full range. Just come to here. You really want to feel your glutes holding you up here. So come down and then press really strongly through your legs to come back up. Do it 5 times. The next exercise, you'll need a step or something. I'm going to use a yoga block. Place it down on the floor. Allow your toes to hang over the side. And then let your hip pop out. But then Activate that side glute by pressing really strongly into your right leg until that hip is back level, until it's vertical. And then lower it back down. Let that hip pop out. And again, press so strongly into the right leg that it's vertical. This strengthens that side glute and helps hold the SI joint more stable. Do 5 times on each side. If you have a weaker side, mine happens to be my right side, I do 5 on my right, 5 on my left, then I go back to my right and do 5 more. Last exercise here, glute bridge with a little bit of a twist. So come to lie down on the floor, knees bent, feet flat on the floor, and then you're going to tuck your tailbone underneath you. So tuck it until the small of your back is pushing into the floor, and then press really strongly through your feet, but allow your right hip to stay down. So you're really pressing really strongly through your right. Or sorry, not your right, your left foot. So your left glute is activating. You're pressing really strongly into your right, or your left foot. I cannot get my rights and lefts. And then switch sides. So you're gonna allow your left hip to drop, push into your right side. And then allow your right side to drop, press into your left side. So you're pressing into whatever side is opposite of the one dropping. And do that 5 times on each side. And notice how your glutes, how your SI joint feels. Thanks for joining me. Bye.